is the wound station. The first thing you would like to do is gather your supplies according to your treatment record, which says you're going to apply a wet to moist saline gauze dressing to the mannequin's wound. So we know we're going to need ABD pads, and we're going to need 4x4s. And you want the ABD pad furthest away from your patient because it's the last thing you're going to use. We're going to need 4x4s, dry gauze sponges. Then we're going to need a gauze boat. We're going to need some normal saline. We're going to need some tape. And I selected the sterile gloves for my size. I tried them on prior to the CPNE beginning, and tape, and I need a pair of gloves. Okay, clean gloves. Okay. And then pliers back. Okay. I'm going to go ahead and mark my tape now so that I won't forget today's date. And the time, and my name. And you want the time that is on your mark. Okay? Or your initials. And you can measure your tape according to the tape that's there already. Also know that depending on hospital policy, if you can do what I'm doing now, which is taping it on the end of the table, some hospitals or facilities do not allow that. So in the when you're actually with a patient, you may need to ask hospital policy when you have wound assessment or wound management for your best care. Okay. The next thing we're do is go ahead and start opening our sterile field. So I'm going to start with the ABD pads. This is the furthest away from me. And actually, I would probably want to turn it with the wrapper outside, being careful not to make it go over. And to protect myself from not touching the other side. And fold the edges back if need be. And then my wound over. I can have more room. This basket is here. And my sterile gloves. Okay. I'll take my normal saline. I'm going to check the expiration date. 11/29/09. That's when it was open. It's the expiration date. Okay, this is a fresh bottle. It's never been opened. And we're going to pour normal saline into the sterile gauze boat. Okay. Let's get out of the way. Now let's don our gloves. To check the wound. removing the old dressing. You loosen the tape on the sides. And you're going to lift with one swoop to make, and look at the drainage and what's on the dressing, so you can document that. You throw it away, and you would throw away then your clean gloves. And you're going to open your sterile gloves. Being careful not to contaminate the sterile field all the way around. Okay. Donning your sterile gloves. And you can take this other paper and throw it away. I'm gathering my 4x4, my moist dressing. I'm opening it all the way, making sure it's not splattering because I squeezed it out. But maintaining its moisture. I'm looking for that corner. Okay. Then I'm going to my wound. I'm feeding it into the wound, making sure not to overextend the edges. And I'm going to get my 4x4, my dry 4x4, and place it over the wound, and my ABD pad. And you want your ABD pad to have the blue side facing you. There's a blue stripe on the ABD pad. Have it facing you. Sitting properly on the wound. At this point, you can remove your gloves. And place your tape on. Making sure to cover all the areas, securing your dressing. Don't forget to sign your mark upon completion of the wound station. Placing your initials next to the time. At the bottom, you're writing in the signature record your name, your initials, ECSN, that's the wound station.